Hello everyone and welcome to Healthway Talks, your go-to source for reliable health information and also to steps for healthy living. Today's episode is very special because we have a distinguished guest with us, Dr.Mahendra. He is a very well-known name in the field of orthopedics in the state of Goa, not only for his experience, which is 20 plus years, but also because he is the only and the first foot and ankle surgeon in Goa. Sports buddies and also students. So pay attention. So sir, tell us what exactly accounts for sports injuries?
So sports injuries are a very special group of injuries which you see not just in high-end athletes but also on the weekend warriors and also in anybody who just plays sports for fun or for maybe as an academic thing or just as a profession. Sports injuries are basically something that you will see more and more since the level of competition and the intensity of training is getting higher and higher. So sports injuries are very, very specific injuries. They should not be treated like a conventional injury.
So in the state of Goa, what are the common sports injuries that we see more often?
In Goa, we have most of the contact sports like football, field sports, then cricket. All these sports are prone for injuries. In addition to that, now we have these high-end athletes who are doing track and field events, also long distance running, maybe like marathon runners, elite runners, or even just runners who have just got into this sport as a passion. So this the spectrum is huge. But if you want to look at the professional part, football, boxing, cricket, volleyball, basketball are the common sports which we see the injuries in, and the commonest area that is injured is the foot and ankle.
Just a general question. Sports injuries relate only to sports personnel or any kind of injury which results in a sports kind of injury in a person can be categorized?
That's a good question. Basically, a sports injury was given a special status because we were looking at high-end athletes who had to get back to that competitive sports as early as possible. So we couldn't treat them like a normal civilian injury who could be given rest for 3 months, 6 months. Here, the injury has to be treated quickly, most efficiently, very, very targeted treatment, so that we are looking at 3, 4 weeks or 6 weeks return to sports. And these injuries can happen even in non-professional people, like, people who are playing weekend sports, or even in the elderly people who are, might have gone for some competition for their age group. What happens is that with youth, the injuries usually happen because you push too hard. Whereas in the weekend warriors and the elderly population, the injuries are because they are not fit enough to do that sport. So the reasons are different. One is that the person is fit and tends to push his body much ahead of or much more than what his body can take. And the intensity and the frequency, all this matters. But on the other hand, you have an average person who is not fit to do that sport, but does it as a passion or does it as a day event and may have sports injuries.
So, would you summarize this as the causes for sports injuries?
Yeah. So, let me just classify sports injuries into two broad categories. One is a sports injury that has occurred by a direct injury, maybe collision injuries or a fall. And the second type of injury that you see in sports injuries is called as a repetitive stress injury. These injuries occur because the athlete trains more often, doesn't rest his body, or they have got too many competitions coming back to back. So the body is overused, there is no rest in between, and that can cause injury. So there are two types. One is the macro injury, that is the direct trauma, and the micro or the repetitive stress trauma, which comes because of overuse.
So would you say that a chronic kind of repetitive stress occurring will result in sport injury? I'm talking about someone who's not really training for sports, but a person, say a working woman in the house or, while she's doing her household chores, can she acquire something like that, and would you categorize it?
Yes. So let me put it, for people, those who are not so fit in that sports or who are not training regularly, they would have issues with excess weight. They would have issues with the muscle elasticity. their ability to move a particular joint, or a sport-specific training is lacking. So any of these four factors, where excess body weight, patient is not physically fit, their muscle endurance is poor, their cardiovascular fitness is affected, and generally their mobility or elasticity of the joints is less, this patients are going to be more prone for any injury, and sports injury just makes it double.
There is a lot of hype as far as a certain kind of gear or footwear or specific kind of training which is given to. Would you really give that much due importance to these things to prevent sports injuries?
So I think this question is so important, specifically in contact sports like cricket, for that matter, where there is a 5.5 ounce leather ball which is very hard, comes at a speed of 130 kilometers an hour, and if it hits in any of the bony part or any of the delicate organs like the head or the eyes or the groin, now these are the areas they have to be protected. So I think it's not just a hype, but it's a basic safety, especially like you've seen other cricketers, how much of protective gear they wear, right from the helmet to even the neck guard, to a chest guard, a thigh guard, the pads, the gloves, because the ball can hit any part of the body and you can have a fracture, and that can sort of, sometimes completely may end the career of that professional. So I think protective gear, especially in football also, again, can protect sports. But the problem is that this protective gear should be as light as possible. It should not interfere with the person's ability to perform. So there has to be that delicate balance between designing. So the design used, the material used should be lightweight. So a lot of research is going on in getting the most appropriate gear that the athletes or the sportsmen have to wear, and it is compulsory. It is absolutely compulsory, so that no injury should stop the career of the person or make him lose the next match, or so that he cannot participate in the next of the tournament. So these injuries are something that you can't predict. Even in the best of the sportsmen, even if he's well trained, it's just an accident. So I think protective gear is a very, very, very important part of component of preventing sports injuries.
So we say that of course, we all know that after exercise, soreness is bound to happen, and it is considered something good. But sometimes athletes or joggers or whatever, people who are training into sports, they feel pain is good and they push a lot. So to what extent pushing pain is good, and when should they stop?
It's a very good question, Dr. Nikat. I think what is important here to understand is that the word exercise is equal to injury. So any amount of exercise, whether you exercise for 1 hour or whether it is for 2 hours, or if you are trying it for the whole day, if the body is not given time to recover, this will result in muscle soreness. There's something called as delayed onset muscle soreness, which happens to any one of us who participate in a weekend sport. Like, you've never played cricket for 6 months and then suddenly you go and play cricket or play basketball. The next 2-3 days, your body is going to be sore, or you go and do weight training. That is because in any exercise, there is a muscle injury. Now, this muscle, once it gets injured, it gets inflamed. So there's production of lactic acid, there is inflammation. So body needs about 48 hours to recover from that. Now, one of the ways of improving that muscle soreness is to use a lot of ice post-exercise. So you see these ice baths that the professional athletes use. So that is the basic reason, to reduce the acute inflammation to the muscles. And that helps them to not only reduce the inflammation, but control the pain and allows recovery of that muscle much faster. So there are a lot of strategies that are available, but I think rest, ice, compression, and elevation. This is a mnemonic that we use for any sports injury. It's called as RICE. The same thing can be used for muscle recovery. Now, if the muscle recovery does not happen in 48-72 hours, then these injuries need to be looked up by the specialist for looking at major tears or if something more serious than that.
So basically, you covered my next question. That was supposed to be my next question as to what is the first aid.
Yeah, the word RICE is something that we use in sports because it's easy to remember, and RICE is something that's easily, can be remembered. The first part of that RICE is rest. When I say rest, in the sense that injured part has to be rested. You cannot keep on playing and think that, it will get all right by itself until the injury is very minor. So if your sports medicine doctor or the physiotherapist advises you to rest has to be taken even if it misses the most important match, because it can sometimes affect your career. Ice is the thing that should be available on the field, because it has to be applied immediately and should be applied for about 48 to 72 hours. And followed by that, good compression to control the swelling, and any injured part, especially the swollen foot or anything, should be kept at an elevation so that it controls the swelling. Because the first part of any injury is to control the swelling so that it does not affect the recovery of the muscle.
So I think everyone's got the key word that do not push yourself too much. You need to follow these rules, and of course, if you don't feel better, you said in 48 hours,
yes,
you have to see your doctor. So the good news is, from all this, we understand that sports injuries are preventable. You follow proper rules, and of course, you have a proper training before you actually go into any kind of specific sports. So Dr. Mahendra, tell us, what are the 3 best preventive tips that you would like to give to our athletes or trainers?
I think one of the things that happens to the athletes is that what is called as a pre-season training. That is, like, when the season gets over, they do not maintain their level of fitness. So before the season starts, 3 months prior to that, they have to start training themselves in a very gradually structured manner so that they start getting their fitness back. And when we say fitness, it is about cardiovascular endurance, it's about muscle endurance, it's about flexibility, it's about sports specific movements. So once you start this pre-condition training and pre-season training, the chances of you getting injured during the season are much less. That is number 1. The second thing is to have a professional to help you in that sports specific techniques. Adequate warming up, adequate cooling down after the sports is vital to prevent sports injuries. So I always tell people that you should warm up and then stretch after the exercise. Warming up is extremely important so that your muscle wakes up, and after the event is over, stretching, icing, having a cold shower as a routine practice is something that helps. Light massage may help, but you have to be very careful. You have to take it from a professional. And the third thing is most important. Once I said is pre-season training, proper training during the season, and using a proper protective gear. I think these 3 tips that every athlete should follow, and then the chances of injuries can be minimized.
Since you're an expert in foot and ankle, would you give us some tips, even for the general, working women, students who have to do a lot of work on their foot? So what do you advise to them?
Actually, sports injuries are common in the ankle, like ankle ligament tears are common. Tearing the Achilles tendon is common. Getting a stress fracture on the foot is common. Sometimes you can, especially in a sports like football, you can get fractures, ankle fractures, midfoot fractures. But like if you said, if there is a lady who has not participated in any sports or fitness is really not good, they can also have injuries in their foot and ankle, specifically because their bones are very weak to start with. They may be having a pre-existing osteoporosis. They may be having some hormonal imbalance. So before they venture into any sports, I think getting a thorough checkup from a good doctor, getting all their parameters good, improving your fitness level to a certain level before participating in any sports, I think is vital. That's why I think we must have a professional coach or someone to guide you, so that you shouldn't just go and start playing for fun, because that could end up in a very bad injury.
So, sir, is there any specific requirement as far as footwear is concerned, or kind of surface that an athlete should train himself on?
Yes, I think especially in track events like running, sprinting, special footwears are required, because that helps them in performing better. It helps in safety. And secondly, the surfaces on what they run, it has to be complementary to the footwear. So the surfaces nowadays are designed to be safe, to absorb shock absorbing capacity. They are weatherproof, and so I think each sports has a specific footwear that the athlete has to wear and not compromise on the quality, because this is not only for performance but also to prevent sports injuries. So they're designed not just for performance but also to protect that athlete from getting certain specific injuries by a special design of the footwear.
What about now people who are just using a common footpath or common roadways, to practice. So for them, what would you advise?
So I'll give you a simple example. Just running on the road to start with is not a good idea, because you need to have a surface which is slightly dampened, which can take your shock. Maybe when you're a high level athlete, like a Nigerian who has been running for 30 years, for him it may not make a difference. But for a person who is starting and he's trying to build up his career as a long distance runner, I think running on the right surface is extremely important, because this is one of the contributors to sports injuries.
What about children who want to start training early?
I mean, see, today, any sports, there is a legal age for them to start. Generally, it is about 6 or 7 when they can actually get into a sport. I think for the contact sports, it's a little later. But they have to be seen by the coach, by the professional. They have to be evaluated whether their body structure is safe enough for them to participate in. Like, suppose somebody wants to get into boxing and the guy is very frail and fragile, and he cannot be recommended at sport. Or somebody who is extremely heavyweight, he can't get into gymnastics. So, one has to design a sport based on that body habitus and the structure of the person.
Are there any specific instructions you would like to give our female athletes?
Yes, female athletes, I think they have an issue, especially the high-end athletes who perform really on a regular basis and very professional. They tend to have a lot of menstrual problems, because when you perform at a regular interval, the balance of hormone changes. It may affect their menstrual cycle, their ovulation cycle. So if they have lack of periods, like amenorrhea, they don't have regular periods, they must go and see the doctor and look at their hormonal profile. So this is one thing. And secondly, females tend to have weaker bones. They tend to have osteoporosis, but it's not a big problem in people who play regularly, but maybe in the women who are very casual, play very casually, and those are the women who are to be careful as far as their bone strength is concerned. And also, women are more prone for ligament injuries because they have more joint laxity. Their joints are more lax, so the chances of getting a patellar dislocation or an ankle ligament sprain or a shoulder dislocation are much higher in females.
So this you're talking about people not really training for some kind of event, but for a general fitness. Of late, we have seen there has been a lot of news about athletes or runners who run marathons, people who are really healthy, and they have been suffered mishaps while the activity or while the marathon is going on, or somebody who's training for very high-end some kind of athletic sport. So what is the cause for this?
So if you're just talking about these sudden deaths that occur on the field, one of the conditions that is always not really looked at is what is called as hypertrophic cardiomyopathy. What it simply means is these patients, the athletes, tend to have a very thick muscle mass in their heart. And here the question comes of screening every athlete for certain conditions before they get into any type of sports. A simple cardiac ultrasound will be able to diagnose this cardiomyopathy. And these people are advised not to play that particular sport. If there is a direct collision, you have seen footballers die on the field, or during boxing. Or another thing that you see is in the gym, people, young 35, apparently 35, 45 people have all good parameters, but suddenly they collapse and die. Now these are the people who may have some arrhythmias, they may be having some conduction disorders. So regular screening would have prevented them. The other factor that is you have to rule out is whether they are using alcohol, whether they smoke, whether they sleep adequately. So these three factors can also predispose them to a sudden cardiac event.
So these conditions, of late we have seen there's a rise. So are you trying to say that this could be the cause?
Yes. So what is contributing is, one is that unaware of that such conditions exist, so where they have to screen them. Secondly, their lifestyle doesn't match their sporting activity. Like they don't sleep regularly, they have late night parties, and they might next day come to the gym in the morning. And lack of sleep, alcohol consumption overnight excessively, and then exercising the next day, that's serious trouble.
So it's good to be motivated to get into sports, and suddenly you decide you have now New Year's is coming, and then you'll have a lot of goals, and of course you'll make your future plans of getting into exercises and all that. So what we would like to focus here, what sir is trying to focus more, is get yourself screened first, check your level of fitness, and only after that decide to what level you can push yourself. to really take your athletic dreams into serious concern. Another very interesting question is, would you like to discuss about doping in athletes?
Yeah, the one thing that I want to mention about doping is that I think all associations internationally are very serious about athletes trying to use performance enhancing drugs to get the edge over the other, because it's become so competitive. Now sometimes the athlete may even take a simple thing like a cough syrup without understanding that what is there in that cough syrup for a common cold, and after the doping he may get caught. And so these are the unfortunate events. But sometimes the athletes do take certain anabolic steroids which are banned, or amphetamines which are banned, or even things like caffeine. So each sports has certain guidelines, so you must be aware of all the rules and regulations and not say that I didn't know about it, because lack of knowledge of the law doesn't make you, you have to, if you're guilty, you're guilty. So it doesn't make you immune to it. So I think here comes the role of the coaches and everybody to understand that doping, especially at high-level athletes, is a very serious issue, and you have to take all the precautions to prevent an unfortunate event.
And for people like us who just want to join the gym and would like to just take a strong cup of coffee, what would you advise? Does it really help?
Yes, I think caffeine for me is a drug, and that's why it makes us feel all good. But what happens is that caffeine is also known to raise your cortisol levels. So if you're trying to lose weight, then caffeine is really not a good idea. One can take 1 or 2 cups of coffee in the whole day, preferably before 3 p.m. because then it affects your sleep pattern. But if you can totally quit caffeine, there's nothing like it. But then when you say caffeine, it is there also in Diet Coke, it is also there in Red Bull. So it is hidden in so many drinks where people have become addicted to it without understanding why they have become addicted. It's not just sugar, but caffeine. So I think we have to be away from these drugs, because they generally affect the health and make you feel good, but on the long term there are detrimental effects on health.
Okay, so I think we've covered pretty much quite a lot on sports injuries, and it has been extremely informative and very interesting session. So we know right now that sports is definitely good for your body, but smart training is what is the key to it. And of course, you need to keep in mind the other important aspects which have been very clearly mentioned by Dr. Mahendra. That includes your preventive checkups and the important protective gear, whether it is an athlete who is training for some serious sports, or even if it is a regular person who wants to join the gym. So all these things have to be kept in mind. We are very lucky that we have doctors like Dr. Mahendra Kochatkar in Goa, who is so well experienced, especially now in the field of foot and ankle surgeries, wherein people would, I think in the past, would have to go across state borders, but now for any kind of injuries and all, he is available for consultation and of course to handle any kind of injuries here in Goa. So a very big thank you to Dr. Mahendra Kochatkar for your valuable time, and I think he's sorted out a lot of doubts and queries, and like I said, this platform is for authentic health related information. So I'm very glad and happy to be a part of this session, and I hope you tune into our future episodes also to get much more informative insights in health related topics. Thank you very much. Thank you, sir. So I hope this session was interesting, and in case you have any more queries which were not solved, or you have any other doubts, you can always get in touch with us on the link below on our social media platforms, or call us directly on the number mentioned on the screen. Thank you very much. Have a nice day.